Let's talk about insulin glargine, better known by its brand name, Lantus. It's a long-acting insulin used to help people with diabetes manage their blood sugar, especially overnight and between meals. Here's how it works. After you inject Lantus under the skin, it forms tiny crystals that slowly dissolve over 24 hours. This provides a steady, slow release of insulin with no peak. That makes it ideal for creating a baseline insulin level to keep your blood sugar stable throughout the day and night. Lantus is typically taken once daily, at the same time every day. It's usually combined with rapid-acting insulin before meals if needed. Who uses Lantus? It's approved for adults and children over 6 with type 1 diabetes, and for adults with type 2 diabetes who need insulin support. Common side effects include low blood sugar, hypoglycemia, injection site irritation, weight gain in some cases. It's important to rotate injection sites to avoid lipodystrophy, thickening or thinning of the fat under your skin. Unlike some other insulins, Lantus can't be mixed with other insulin types in the same syringe. Bottom line, Insulin Glargine provides smooth 24-hour blood sugar control, making it a cornerstone of many diabetes treatment plans. Talk to your doctor to see if it fits your insulin routine. If you found this helpful, hit like and subscribe for more medical animations.